Welcome to another episode from the Veterinary Research Channel. I'm Ava, and with me today is Brian.
Hi everyone, it's great to be back. Today we're diving into a fascinating piece of research focused on mast cell tumors in our canine companions.
That's right, Brian. Mast cell tumors, or MCTs as they are often abbreviated, are a common type of cancer found in dogs. Understanding how these tumors spread and the best way to manage them is crucial for improving the lives of our furry friends. A key factor in determining the prognosis and treatment plan for dogs with MCTs is whether the cancer has spread to the lymph nodes.
Traditionally, when veterinarians evaluated the potential spread of MCTs, they often focused on the regional lymph nodes, which are the lymph nodes closest to the primary tumor. However, in recent years, the concept of the sentinel lymph node has gained significant attention.
Exactly. The sentinel lymph node is the first lymph node or nodes that receive drainage from the tumor site. It's like the primary guard post. If cancer cells have begun to spread through the lymphatic system, the sentinel lymph node is the most likely place to find them first. Identifying and examining these sentinel nodes can give us a more precise picture of whether the cancer has metastasized.
And the article we're discussing today delves into a specific way of classifying any cancer cells found in these sentinel lymph nodes, known as Weishaar's classification system. This system, developed in the past, has become a valuable tool for staging MCTs and guiding treatment decisions. It essentially categorizes the extent of tumor involvement within the lymph node. However, the original studies on Weishaar's classification often looked at both regional and sentinel lymph nodes together and sometimes included lymph nodes that were already visibly enlarged or abnormal. This new research we're exploring today aims to provide a more focused understanding of how Weishaar's classification in normal-sized sentinel lymph nodes identified using advanced imaging techniques relates to the clinical outcomes in dogs with mast cell tumors. The researchers wanted to update our knowledge about the connection between these histological nodal classifications and what actually happens to the dogs after their tumor is surgically removed and their normal-sized sentinel lymph nodes are also taken out, guided by a special radiopharmaceutical marker.
So, let's get into what the researchers actually found. They conducted a study involving 94 dogs that had been newly diagnosed with mast cell tumors. These dogs had different types of MCTs, some in the skin, some under the skin, and even one on the conjunctiva, which is part of the eye. Importantly, all these dogs were without any evidence of the cancer having already spread to distant organs or causing their lymph nodes to become enlarged. The researchers meticulously examined the characteristics of the tumors and then classified the sentinel lymph nodes that were removed based on Weishaar's system. They followed these dogs over time, recording any instances of the MCT returning locally, spreading to other lymph nodes or distant sites, the development of new MCTs or other types of tumors, and sadly, any deaths, noting whether they were related to the MCT or other causes.
What did they discover when they looked at these sentinel lymph nodes? Well, in this group of dogs, 27 had no evidence of metastasis in their sentinel lymph nodes, which is classified as HN0. 19 dogs were classified as HN1, meaning they had a small number of mast cells within the node. A larger group, 37 dogs, fell into the HN2 category, indicating more significant involvement but without complete replacement of the lymph node tissue. Finally, 11 dogs had HN3 sentinel lymph nodes, showing extensive metastasis where the tumor had largely replaced the normal lymph node structure. Interestingly, a small number of dogs in the HN0, HN2, and HN3 groups also received adjuvant chemotherapy, meaning chemotherapy given after the primary treatment, usually surgery.
One of the interesting findings was that higher Weishaar classifications seemed to be associated with certain tumor characteristics. Specifically, tumors classified as cupal high-grade, meaning they were considered more aggressive based on cellular features, were more likely to have higher HN classifications. They also found that dogs with a greater number of sentinel lymph nodes identified and a greater number of sentinel lymphocentrums, which are clusters of sentinel lymph nodes, also tended to have higher HN classifications. However, other factors like the location of the tumor, whether it was ulcerated, the Putnam's grade, another grading system for MCTs, or the size of the tumor didn't show a statistically significant association with the HN classification in this study.
When the researchers followed up with these dogs to see what happened over time, they recorded a total of 31 events related to new tumor development or recurrence. Only 4 of these were actual relapses of the original mast cell tumor, 2 instances of the tumor returning locally near the original surgical site, and 2 cases where the cancer spread to distant organs. Notably, they did not observe any cases of the cancer recurring in the sentinel lymph node area that had been surgically explored.
Furthermore, 14 of the dogs developed entirely new mast cell tumors at different locations, and 13 dogs were diagnosed with other types of cancers that were not mast cell tumors. Sadly, 21 of the dogs passed away during the study period, but only 5 of these deaths were directly attributed to the progression of their mast cell tumors. These included the 2 dogs with local relapse and the 2 with distant metastasis, as well as 1 dog that developed progressive disease from a new subcutaneous mast cell tumor. The majority of the deaths were due to other causes, such as other new cancers or unrelated health issues.
Given the small number of actual MCT relapses, the researchers couldn't perform a detailed statistical analysis to see how the Weishaar classification specifically predicted the risk of the original tumor coming back. However, they did look at the overall occurrence of any MCT-related event, including relapse and the development of new MCTs, across the different HN classes. Interestingly, they didn't find any significant differences in the rate of these events between the HN0, HN1, HN2, and HN3 groups. They also examined whether adjuvant chemotherapy made a difference in the likelihood of these events occurring, but again, no significant benefit was observed in the dogs that received chemotherapy compared to those that didn't.
This brings us to the discussion of these findings. One of the most notable points is that, contrary to some previous understandings, dogs in this study with low-grade or low-risk mast cell tumors that had an HN2 classification in their sentinel lymph nodes actually had a clinical outcome that was just as good as those with HN0 or HN1 classifications. And this was often the case even when they didn't receive chemotherapy after surgery. Similarly, dogs with low-grade or low-risk MCTs that had HN3 sentinel lymph nodes seemed to have a good outcome if they received adjuvant chemotherapy. Brian, it's important to highlight that.
It's important to highlight that only 5 dogs in the entire study died from causes related to their mast cell tumors, and this outcome didn't significantly correlate with their Weishaar classification. The researchers pointed out that the dogs that did succumb to their MCT often had other negative prognostic factors present, such as incomplete surgical removal of the primary tumor, higher tumor grades, or high proliferation rates, which could have influenced the outcome more than the HN status of the sentinel lymph node alone.
The researchers also compared their findings to the original study that proposed the Weishaar classification system. In that earlier work, a worse prognosis was generally associated with higher HN classifications. However, this new study, focusing specifically on normal-sized sentinel lymph nodes identified with advanced techniques, presents a somewhat different picture, especially for lower-grade tumors. The researchers suggest that one reason for this discrepancy could be that the original study didn't distinguish between sentinel and regional lymph nodes, and may have included dogs with more advanced disease at the outset. Also, the lack of cupal grading in the older study might have led to some lower-grade tumors with nodal metastasis being categorized in a way that suggested a worse prognosis than they might actually have had based on more modern grading systems.
Another key difference might lie in the surgical approach. In this study, the use of radiopharmaceutical markers and intraoperative gamma probes combined with methylene blue dye likely led to a more accurate identification and removal of all relevant sentinel lymph nodes within the draining areas. This thorough approach could explain why they didn't see any nodal relapses in their study, even in dogs with higher HN classifications. In contrast, a study that relied more on visual identification of lymph nodes might have missed some affected nodes, potentially leading to local recurrence in those areas.
The researchers also noted that the finding of multiple sentinel lymphocentrums or a higher number of sentinel lymph nodes being removed was associated with higher HN classifications. This suggests that a single mast cell tumor might drain to more than one area of lymph nodes, and when there is more extensive metastasis, it might involve a greater number of these nodes.
Finally, regarding chemotherapy, because the treatment protocols weren't standardized in this study and the number of MCT-related events was low, it's difficult to draw firm conclusions about the specific benefit of chemotherapy based solely on these results. However, the practice of offering chemotherapy to dogs with HN3 sentinel lymph nodes and higher-grade tumors aligns with current recommendations aimed at addressing the higher risk of systemic disease in these cases.
In conclusion, this research suggests that for dogs with low-grade or low-risk mast cell tumors that don't have enlarged lymph nodes and haven't had their cancer spread to distant sites, the presence of even significant metastasis in their normal-sized sentinel lymph nodes might not necessarily indicate a poor outcome, especially when a comprehensive sentinel lymph node mapping technique is used. At this time, adjuvant chemotherapy appears most strongly indicated for dogs with HN3 sentinel lymph nodes. The researchers emphasize that their findings are closely linked to the specific methods they used for identifying and removing sentinel lymph nodes, highlighting the importance of accurate staging in the management of this common canine cancer.
This study provides valuable insights that help refine our understanding of mast cell tumor behavior and the role of sentinel lymph node evaluation. It underscores the importance of using precise diagnostic techniques and considering the overall characteristics of the tumor when making treatment decisions.
Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.